My name is Deborah Ashby. I am the RSS president, at least for another couple of months until the end of this year, so in my final flourish. I am absolutely delighted to be chairing this event, which is joint between the Royal Statistical Society and the Office of National Statistics. Little bit of housekeeping, no fire alerts, no fire things, obviously, because we're all in our own places. But firstly, can I ask everybody to switch their camera and their microphone off, except when they're actually talking? So that will keep noise down to a minimum. And secondly, to let you know, I think you should be able to see it in your screens, we are recording this. By coming in, you've consented to that. We're aiming to make this publicly available. That's two consequences. One is when you speak, please be, I hope you would be anyway, but factual and use decent language and so on. And then secondly, if you do say something or, for example, refer some data that actually it's still a bit confidential, if you could email the RSS LUTs afterwards, then it would be possible to edit something out. So don't worry too much. But if you do afterwards think, gosh, I'd rather that wasn't in the public domain just yet, then just let us know and we'll do what we can do. So why are we doing this? Most of you, certainly those in the UK, will remember that back in June, Black Lives Matter really came to the fore here. It started off from events in America, but spread around the globe. And that was certainly a challenge to me as president, thinking, and not for the first time, what can we do for diversity, but in particular on ethnicity? And I made, after some reflection, first I didn't think I had anything useful to say that wasn't completely generic about how horrified I was by events. But when I thought about it, I thought, actually, I do have something to say, and I have something to say as leading a preeminent statistical society. So I made a statement, and then following discussion at Royal Statistical Society Council, I then launched a strategy at our conference in September. And there are 4 strands to that. The first of which is that we want our fellowship to be as diverse as appropriate, and what can we do to make sure that we're inclusive and we bring in all the groups that we want that should legitimately be part of the RSS. Secondly, and this built on work we were doing anyway, are our staffing policies, our recruitment, again in line with best practice for giving opportunity to all. And also, I firmly believe both fellowship and staff, having a diverse group of staff is far better than having people all of one type or all of one mindset. Diversity is very multidimensional. The third thing that it caused us to revisit, and we had a very good meeting last week, is the history of racism. There's been long-running debates, feelings run very high on the roles of people like Galton and Fisher and what that means for today. Some of you will know that the Fisher Memorial Lecture has now been renamed by other organisations. So we thought about that. But the thing I'm, in a sense, most excited about is, and this is what actually encouraged me to make a statement publicly, is that statistics is part of the solution. Yes, maybe we've got skeletons in our cupboard, maybe they're not skeletons we should worry about. But actually, data is what helps tell us what's going on. Data is what gives us clues as to how we can improve things. And so the forward-looking part is the bit that I think we've possibly had the least discussion about, but to my mind is actually the most important. The others are prerequisites, but actually helping change the world for the better. So part of that is about what data is available on ethnicity. And so I'm absolutely delighted that people who've been working in this area much longer than I have are going to be talking today. And I think the purpose is partly to explore this and partly actually to make public the good work that is going on in statistical worlds, but also to raise questions about what could make things better. So we've got 3 speakers. I will introduce them one by one. What we're planning on doing is taking those talks back to back so that we can then have a joined up panel discussion afterwards. We will be asking people to raise their hands, but equally, if you want to put things in the chat, either to put down a marker or for a separate side discussion, that's fine. I'll be keeping an eye on the chat as well as the hands raised as to what feeds into that discussion. So with no further ado, I'm going to introduce firstly Liz McKeown. She leads the development of the Office for National Statistics Public Policy Statistics Analysis alongside Emma Rook. Her brief is wide-ranging. It covers population, migration, crime, living standards, cross-cutting policy issues. And before she joined the ONS, she's held senior roles in government, including chief economist at the Cabinet Office, so quite a lot of diversity even within her own CV. So Liz is going to talk to us about new initiatives on inclusive data at ONS. So Liz, over to you.
I'm really pleased to be speaking at this event today, echoing much of what Deborah's just said in her introduction there. The ONS is very pleased to be a part of today's event. And I think it's one which I think we can all agree is really timely and important. Timely because without a doubt, COVID-19 has shone a light on the inequalities faced by different groups. And we've seen different groups been impacted so differently. And I very much agree on that forward-looking part that Deborah has just mentioned, that we as statisticians have a really important role to play to ensure that our statistics can provide the information that decision makers, be they citizens, be they policymakers, be they businesses, need to tackle the pandemic and support the recovery from it. But if our statistics are going to be effective, they really need to reflect the whole of society so that we can properly understand the different issues being faced and have the right evidence base to tackle it. I think it's clear that ethnicity data gaps remain. Today, I'll talk about some of our recent work to fill them, but I'll do so in the context of our broader work to make a step change in the inclusiveness of how we collect, analyse and report on data. So, as I was saying, inclusiveness is really a key priority for ONS, and we're working to embed it in a number of ways. It's a key element of our strategy for the next 5 years, and it's fundamental to the organisation we want to be, the research we do, the statistics and outputs we produce, and how we do it. And you can see from this graphic, it's one of our 4 core principles. This builds on a lot of previous work undertaken in ONS. 2 years ago, we established the Centre for Equalities and Inclusion to work with others to identify and try and fill data gaps. We are also signatories to the Inclusive Data Charter, which is linked to Sustainable Development Goals. And more recently, the National Statistician launched an Inclusive Data Taskforce, of which more later. So addressing ethnicity data gaps is very much part of this wider focus on inclusiveness. In today's presentation, I'm going to talk about the ways we're making improvements and where we still have further to go. I'm going to look at how we've been diving deeper into existing data, how we've created new data, especially in relation to the pandemic, and also how we've explored lived experiences. But I also want to touch on how we're collaborating with others to make more and quicker progress in this area and how important that collaboration is. But first, let me give you a flavour of some of our recent analysis. Much of it is related to the pandemic, but I wanted to start with some of our wider work over recent years to fill some of our evidence gaps on ethnicity. So we published analysis on ethnicity pay gaps for the first time last year, and last month updated that analysis. Following feedback from last year, we looked at a more detailed set of ethnic groups this year. So on this slide, we can see that the gap has narrowed to its smallest level since 2012. However, we can also see from the chart on the right-hand side that the aggregate picture masks differences for different ethnic groups, with many earning less on average than their white British counterparts, which is the 5th group down on the right-hand side chart. As part of this analysis, we also undertook pay modelling to strip out the effects other characteristics may have on average earnings for different ethnic groups. For instance, typical occupations and education levels can differ between ethnic groups and are likely to impact on their average earnings. When accounting for the other characteristics, we see most of the pay gaps narrow. However, this is more the case for those groups earning more than the white British group, which includes the Indian and Chinese. And for those earning less on average, the gap tends to narrow by less, or in some cases widens further. So we want to keep refining our modelling to understand much more of what might be explaining those differences. But I want to turn now to how we responded to the COVID-19 pandemic and worked hard to create the data we need to address the new policy challenges we faced over the last months. At ONS, we've been producing statistics faster than ever before over this period. And right from the outset of the pandemic, we recognized the need to understand the impact of the pandemic on different groups. To help us explore those differences and disparities, we rapidly stood up a number of new surveys since the start of the pandemic, aimed at understanding both the social and the economic impact of the pandemic, and also by launching the coronavirus infection survey to provide crucial information on levels of positivity and the characteristics of those who test positive. That's obtained via nose and throat swabs. And we also, at the same time, collect information on positivity for antibodies via blood tests. So this slide presents some analysis we published in September, exploring the likelihood of testing positive for COVID-19 antibodies by different characteristics. Again, estimates are modelled here to identify the risk associated with each characteristic while controlling for the effects of other characteristics. The key finding here was that individuals identifying as Asian or Asian British ethnic groups were 2.7 times more likely to have ever been infected by COVID-19 over the study period than those identifying in the white ethnic group. So this is based on blood samples taken since the start of the study on the 26th of April up to the 2nd of September 2020. For those identifying with the remaining ethnic groups, it's not possible to draw conclusions about their relative likelihood of testing positive. This is due to low numbers of people and positive cases identifying with ethnic groups other than white, meaning confidence intervals are really wide at this point. So future analysis may help to provide more information there. So I want to turn, as well as launching new surveys, it's been really important to also link different data sources to drive new insights over this period. New legislation, the Digital Economy Act, enables data to be shared with ONS for statistical purposes, and the linked records bring information together to provide new insights. This has been really important during the period of COVID-19, as currently ethnicity is not recorded on a death certificate, and so linking data sources has been really important to be able to understand different patterns here. So what have we done? We linked COVID-19 death records to 2011 census so we can identify a person's ethnicity and their socioeconomic factors, and then also linked on to hospital episode statistics so that we could investigate whether certain pre-existing health conditions across ethnic groups might account for the disparities in COVID-19 mortality between ethnic groups. The chart on this slide, from analysis we published last month, confirms raised rates of COVID-19 mortality remain for both males and females of Black African, Black Caribbean, Indian, Pakistani, and other ethnic groups compared to the white ethnic group, after taking account of demographic, socioeconomic, and health-related factors. Taking into account geography, socioeconomic characteristics, and health measures, including pre-existing conditions, males of Black African background retained a 2.5 times higher rate than those of white background, while for females, a 2.1 times greater risk remains. So there remains much more to do to understand these remaining differences. And I know that in the second presentation we'll hear today, we'll hear more of the work done to try, both done and being done, to explore this area in more detail. Earlier in the summer, before we had the linked data available that I've just outlined, we needed to triangulate data from different sources to help explore some of the disparities we're seeing in COVID-19. So on this slide, I want to touch on how we've triangulated different data sources. And here we've used data from the annual population survey to look at ethnicity and occupation, and separate data from death records on the occupations of those whose deaths were recorded as involving COVID-19. The goal in triangulating across these data sources was to better understand whether some occupations are more linked to COVID deaths and whether these occupations are disproportionately done by Black and/or Asian ethnic groups. So the table on this slide shows the 17 occupations with the highest elevated rates of death involving COVID-19 for males. 11 of the 17 occupations had higher proportions of Black and Asian ethnic group workers. We've also done work focusing on our higher risk groups. So in July 2020, we looked at household composition by age to see differences in ethnic groups, specifically looking at households with a person aged 70 and above, where we know there's a greater risk of serious illness or mortality. So on this slide, we can see all ethnic groups, when compared with the white group, have a higher proportion of someone under the age of 49 in households, in a 70 plus household. The orange bar represents households with a 70 plus, someone, whilst not, and probably worth noting that whilst not necessarily indicating these are multi-generational households, we're seeing real differences in household composition from different ethnic groups, with older and younger people living together in the same households, which could be an important factor when considering which ethnic groups are more at risk of COVID-19. So far I've talked a lot about our quantitative and statistical work, but we've also been exploring lived experiences and seeing the value that qualitative research can bring alongside our quantitative research. In September, we published A Diary of a Nation, which looked at the written responses from the OPN survey over the period of the pandemic to reflect the feeling of the nation through their own words. We're currently commissioning further qualitative work to understand how people understand and engage with COVID-19 guidelines across a range of diverse groups, including those from different ethnic backgrounds. This slide, meanwhile, provides some insight into the quality of life during lockdown for diverse ethnic groups. To understand experiences of lockdown across ethnic groups, we studied Ordnance Survey map data as well as the Monitor of Engagement National Environment Survey. In England, Black people are nearly 4 times as likely as white people to have no access to outdoor space at home, whether it be private or shared garden, a patio or balcony. This is according to survey data from Natural England published in May 2020. Even when we compare people of similar age, social grade and living situation, those of Black ethnicity are 2.4 times less likely than those of white ethnicity to have a private garden. And we can see the impact that that has during periods of lockdown. So I think hopefully that I gave a flavour of the different analysis that we've been doing to help fill some of the ethnicity data gaps, both on wider policy issues and especially on the COVID-19 pandemic. I think it's very clear, though, that that there's a much broader shared responsibility to get the right data, statistics, analysis, and evidence in this space, and we are very keen to work with others to make progress. So I just want to spend a little bit of time touching on how we're doing that. When the Centre for Equalities and Inclusion was set up, we undertook an equalities data audit, which used a crowdsourcing model to collate information about equality data sources across government, the devolved administrations, academia, and civil society. We worked in collaboration with others from across government and the Equalities and Human Rights Commission to refine the final product and update it regularly to make it easier to find equalities data. We are also working really closely with the Race Disparity Unit, who we'll hear from next. And we're providing analysis to the Commission on Racial and Ethnic Disparities and working on collaborative analytical work on ethnicity. So at the moment we're undertaking some work on ethnicity and the social impacts of COVID-19 using Understanding Society data. And this is a collaboration between ourselves, the Race Disparity Unit, LSE and IFS, with a publication expected in December. Our latest initiative is the launch of the Inclusive Data Taskforce with the aim of creating a step change in the inclusive data infrastructure of the UK. Comprised of senior academics and civil society leaders, it will consult widely on equalities data priorities across the UK to better understand needs and make recommendations to the National Statistician. ONS will shortly be launching an online consultation on behalf of the task force to gather views about key equality priorities, and we'd really welcome your input on that. The overall aim of the task force is to make a step change in the inclusive data holdings of the UK. It will require collaboration across government, civil society and academia to take forward the recommendations of the task force and move closer to the vision of more inclusive data on ethnicity and a range of other equalities groups. So some of the issues the task force will tackle will include improving data collection and engagement, covering things like improving trust, filling gaps in coverage of different groups and their lived experiences, collecting more equalities data and administrative sources, and better engaging groups when we're designing data collection. Secondly, making better use of what we already have. This covers things including improving comparability, increasing accessibility, reusing and repurposing data, and better use of administrative data. Thirdly, developing more and better equalities data, including harnessing the opportunities of the census, data science, and new studies and data linkage, as we've discussed earlier today. Fourthly, improving our analysis and dissemination, embedding the human rights approach, ensuring we meet society and policies needs, identifying the key priorities for census analysis, and improving granularity, which we know is so important. And then finally, leveraging collective momentum to develop an equalities data ecosystem, joining up to improve data, defining the right priorities across stakeholders, and learning from international initiatives and creating momentum for collaboration and progress, which is so needed. So we will, as I said, we'll shortly be launching an online consultation, and we would really welcome all of those on the call to engage with that at the time. If people have ideas in the meantime, we have a link there which people can email us in. And I appreciate that finding out more about the Inclusive Data Task Force here, you can't click on that, but I will put the link to that in the chat bar so people can access that. So I'll end there. Thank you very much for the opportunity to share what we've been doing today. Look forward to the next two presentations and the chance to discuss further after that. Thank you.
Thank you, Liz. That was a great start, and you've kept nicely to time. As you may have seen, or you may see up if you have a browse now, there are questions going in the chat. So you've obviously been stimulating people to think. But as I said, we're going to take the presentations back to back and then come to the questions. So the next person I want to introduce is Vasileios Antonopoulos, who leads on the Race Disparity Unit's work to clarify the scale and drivers of the data and evidence gaps related with higher risk of COVID-19 mortality and infection for ethnic minority groups. He and his team work collaboratively across government and with the Office for National Statistics, but they also liaise with universities and researchers to build the evidence base and get a better understanding of what's driving these disparities. And initial results of this work were published in the Minister of Equality's first quarterly update to the Prime Minister. So Vasileios is going to talk to us on data and evidence gaps on the relationship between ethnicity and COVID-19 diagnosis and mortality. So I'm handing over to you.
Thank you. As they said, I'm Vasileios Antonopoulos. I'm head of analysis in Race Disparity Unit. First and foremost, a few words about Race Disparity Unit. We have been trying to present data on ethnicity on the Ethnicity Facts and Figures website to reveal variances in outcomes that ethnic minorities may face. At the moment, RDU presents more than 170 indicators split by ethnicity, including data from surveys and administrative data sources. The last few months, Race Disparity Unit has been focusing more on the relationship between ethnicity and COVID-19 diagnosis and mortality. Today, I will present the existing evidence that we have on that question. In more detail, as mentioned earlier on, Race Disparity Unit has been working with other government departments and academics to clarify the scale of the drivers of the gaps in evidence highlighted by the Public Health of England report on disparities from COVID-19, published in the beginning of June. At the moment, we know that ethnic minorities are more likely to test positive from COVID-19, to be admitted into ICU, and have higher risk of mortality. When the pandemic started in March, we had very limited evidence on how ethnic minorities were affected from COVID-19. The main reason for that is that ethnicity is not recorded on the death certificate, but there was also a general lack of data on testing. The only evidence that was published in April was the data from the Intensive Care National Audit and Research Center, which showed that almost a third of the patients in intensive care were from ethnic minority background. This is almost twice as the proportion of people from ethnic minorities living in the United Kingdom. To provide more evidence on the disparities, ONS linked death registration data with the 2011 census to obtain the ethnicity of the people who had died from COVID-19. Public Health England linked their surveillance system data, NHS data, and also hospital episode statistics to obtain ethnicity. Both studies found similar results, and in June, Public Health of England reported the results of a survival analysis among confirmed COVID-19 cases. This shows that after accounting for the effect of sex, age, deprivation, and region, people from Bangladesh ethnicity had around twice the risk of death when compared to people from white British ethnicity. People of Chinese, Indian, Pakistani, other Asian, Black Caribbean, and other Black ethnicities had between 10% and 50% higher risk of death when compared to white British. That was a big milestone and very good analysis based on the data that was available at the time. However, the analysis did not take into account some risk factors that were thought likely to explain some of the disparities. For example, we know that people from ethnic minorities are more likely to have occupations that they give them higher exposure to COVID-19, as Liz presented earlier on, live in overcrowded households or multi-generational households, and have poor quality of houses. But the most important data gap at the time was for this research was that comorbidities and obesity had not been taken into account for the mortality analysis. I'm saying that because people from ethnic minorities are more likely to have health conditions such as diabetes, heart disease, cancer, which are diseases which in combination with COVID-19 can increase the risk of mortality. Also, academic articles at the time suggested that disparities could be explained by including comorbidities in the mortality analysis. To address these data gaps that I mentioned, the RDU engaged with academics, other government departments, and ONS to support and to identify solutions on how some of these data gaps can be solved. And what I would like to mention today is the two latest papers that they have been published. First and foremost, a paper from OpenSafely. OpenSafely is a new secure analytics platform for electronic health records in the NHS, created to deliver urgent results during the global COVID-19 emergency. It is now successfully delivering analysis across more than 24 million patients, full anonymized primary care NHS records, with more to follow shortly. They have currently linked the full coded primary care record, maintaining all previous medical history, test results, diagnosis, medications, treatments, A&E attendance data, hospital death from COVID-19, ITU data, ONS death data, including cause of death, and they are rapidly mapping new data sets where required. In this slide, I present the results from the paper Ethnic Differences in COVID-19 Infection, Hospitalization and Mortality, an OpenSafely analysis of 17 million adults in England, published in September. The graph presents hazard ratios after adjusting for age, sex, deprivation, all specified clinical comorbidities, categories of BMI, average blood sugar levels for the last 2 or 3 months, systolic, diastolic blood pressure, number of primary care consultations in the previous 12 months, household size, care home residency, and stratification by region. This study found that after accounting for all these different factors, still some of the disparity remains. And in more detail about the results, we can see that the relative risk of COVID-19 death was highest in the Black African group, and this risk was increased by 78%. Other results from this analysis is that Indian and Black African groups were at higher risk of all outcomes studied compared to white British, namely being tested and testing positive from coronavirus, being admitted to ICU for COVID-19, and dying from COVID-19. Also, Pakistani and Bangladeshi groups were less likely to be tested for coronavirus, but more likely to test positive, be admitted to ICU, and die from COVID-19 compared to white British. And Black Caribbean groups were equally likely to receive a test from COVID-19, but at higher risk of all other outcomes compared to white British. The other work that I would like to mention, and Liz mentioned that briefly, is the analysis from ONS. ONS recently, they linked data from hospital episode statistics, and they provide a similar analysis. So these figures reveals how much the estimated risk of death decreases when accounting for non-characteristics of individuals, such as location, household composition, socioeconomic position, highest qualification held, household tenure, multi-generational household flags and occupation indicators, including key workers and exposure to others in 2011, self-reported health and disability status in March 2011, and hospital-based comorbidities since April 2017. What I would like us to focus in this chart is I would like us to show how these different factors explain some of the disparities that we originally have. So if we look at the Bangladeshi group and the light blue line, when we adjust for age and sex, Bangladeshi males were 3.5 times more likely to die from COVID-19 compared to white men. When we account for geography, the disparity for Bangladeshi males is reduced to 2.3 times more likely to die from COVID-19. The likelihood is reduced to 1.9 when we account for socioeconomics, and when we account for health status, the disparity is reduced further to 1.4. If we look at the Bangladeshi women, the risk of dying from COVID-19 after adjusting for all these factors is equal to white women. As you understand geography, socioeconomic factors and health factors explain a large part of the disparities, but a part remains unexplained, especially in Black African and Black Caribbean males. Before I discuss more about data gaps, I would like to mention something about the data quality issues that we face on this research. Quite a lot of data that have been linked to Census 2011. And the main concern when we link data back to Census 2011 is that we are using data for that are almost 10 years old now. But most importantly, do not include two groups of people, those who have arrived since Census Day in March 2011 and those born after March 2011. The first group is more important, as very small numbers of young children have died so far. But in terms of infection, both groups could be important. For example, in terms of children being carriers of the disease, even asymptomatic, and how likely they are to transmit it to others. Many sources collect demographic characteristics such as ethnicity for respondents, but often the sample sizes are not big enough to support robust analysis for these variables that can detect changes over time and difference between groups. As a consequence, it is hard enough to get robust data for ethnicity alone in sample surveys, almost impossible for ethnicity by sex or by disability, for example. And last but not least, some ethnicity formation is incomplete and not harmonized, and this makes data linkage much harder. So what are the existing data gaps that we would like to focus more over the next couple of months? Evidence from REACT-2 found that there was an association between adjusted prevalence of antibodies at household size, ranging from 4.7% in single occupancy households to 13% in households with 7 or more occupants. People from ethnic minorities are more likely to live in overcrowded households, large households, and in households with poor housing conditions. The data that we have at the moment are from Census 2011, and they may not capture the existing housing conditions. As Liz mentioned, some occupations carry a higher risk of getting infected with COVID-19, as the job cannot be undertaken at home. People still need to commute to work in order to provide essential services for the community. 1.4 million key workers were from ethnic minorities, making up 14% of all key workers, 5% of the total workforce, and 20% of those in high-risk occupations, compared to their 11% involvement in the total workforce. In frontline healthcare workers in the UK and USA, ethnic minorities experienced a great risk of a positive test and reporting inadequate access to effective personal protective equipment. Furthermore, we need to improve our understanding of whether and how behaviors differ by ethnicity, such as allowing public health accommodations, such as following public health accommodation is important, but also how the difference in health-related behaviors may influence the excess risk that ethnic minorities are facing. Furthermore, access to healthcare is a very important question, as there is limited data on access to healthcare during COVID-19. However, the ISARIC CCP study found that amongst people who had been admitted to hospital, ethnic minorities had similar delay between the onset of symptoms and their hospital admission. But also we'll need to look more in detail about ethnicity and also vulnerable groups. We need to look at migrants, asylum seekers, homeless, rough sleepers, and unemployed people. So some suggestions on how we can work to solve these data gaps during the wave 2 of the pandemic is by looking on further data linkage. For example, if we link Open Safely data with the ONS infection survey, which includes occupation, this may provide, may explain some of the excess risk that we see at the moment for ethnic minorities. Furthermore, linking English housing survey with ONS infection survey may provide more data on ethnicity and how on ethnicity by different household types and how this may affect infection as well. One recommendation that we are trying to work on is mandating the collection of ethnicity data as part of death certification process in England and Wales. And this will help widely the evidence on ethnic minorities, and especially health inequalities, by looking more about life expectancy as well. Last but not least, I would like to mention that we would like to see better representation of ethnic minorities in social survey, such as the Opinions and Lifestyle survey and the ONS infection survey. It will be very nice and very good for policy interventions to have better data on that without such high confidence intervals. And that's from me. Thank you very much.
Thank you very much, Vasileios. That was great. And again, the chat is going absolutely mad. And I think you began to address some of those issues, but we'll pick them up in discussion. And absolutely delighted to hear you citing React 2. Just declare my interest in this. I'm a collaborator and author on React 1 and React 2, which are sort of very complementary to some of the ONS work. So our third speaker is, we've got some diversity coming in here because she's based in a university at the moment, the University of St Andrews. So Nissa Finney is a reader in human geography. She's at St Andrews, she's part of the Centre on Dynamics of Ethnicity. And that's a research centre which provides theoretically informed, empirically grounded and policy relevant research on ethnic inequalities in the UK. Her work is broadly and theoretically framed by her interest in inequalities and social justice. And she's going to talk to us about surveying ethnic minority populations in times of crisis. So Nissa, over to you.
Thanks, Deborah, and many thanks to the RSS and the ONS for organising this event. I'm really glad to be involved, so thank you for the invitation as well, and to all of you for coming along. And before I begin, a few acknowledgements. First of all, to the Economic and Social Research Council who are funding this work, and to my collaborators on this project, whose names you'll see in just a moment. This is very much a collective effort. So I will share my presentation with you. So I want to talk to you this morning about a new project being undertaken within the Centre on Dynamics of Ethnicity. And this is part of funding received by the Centre from the ESRC as COVID response research. So there's a wider programme of work going on, of which this survey is one part. It's a quick response project, so it's running from September this year to March next year. So you'll begin to see the challenge that we have in completing this ambitious project in that time. And this is so hot off the press that our survey doesn't even have a name yet. So I'm very much looking forward to the comments today, which can feed into the ongoing discussions and project development. So what will this survey do? The survey is going to provide unprecedented evidence for equality. So a very proactive approach to addressing the kinds of inequalities that we've just been hearing about. We aim to achieve a comprehensive coverage of 16,000 ethnic minorities across Britain, and to deliver scientific robustness through an innovative non-probability survey methodology. The fourth distinctive aspect of the survey is that we're going to cover social issues of relevance to ethnic minorities that are not currently covered by other data. So why is this new survey needed? Well, we've been hearing about the ethnic inequalities and how they have been particularly highlighted this year during the coronavirus pandemic. And indeed, we believe there's a need to provide robust evidence to engage in these debates as we're doing today and to shape interventions to address these ethnic inequalities. So we want to capture populations that are, if you like, hard to reach, that are rarely part of traditional surveys and data sources. We want to survey more ethnic groups than we see in most data sets. And we want to recruit from more geographical areas, not just those places in which ethnic minorities tend to be clustered. And crucially, what's distinctive about this project is that we want to gather content that is not gathered elsewhere, including on racism. And here we're building on previous code work, including this book here, published this work about the state of the nation on ethnicity, race and inequality. So we're particularly interested in the social experiences and processes that lie behind the patterns of inequality that we've seen today. So who are the ethnic minority populations that we're interested in? I think this is a fundamental question for all interested in collecting and analysing data. What does ethnicity mean? Why do we need to be concerned about ethnicity and ethnic minority populations? So we're taking a somewhat different approach to this in our survey, and anybody who considers themselves to be an ethnic minority is invited to take part. So there's no exclusion or inclusion criteria based on ethnic minority identification or on neighbourhood of residence. However, in order to ensure a comprehensive sample across ethnic minorities, for our non-probability approach, we will set quotas as a basis for our statistical monitoring and adjustment. So to give us this statistical robustness, we will be recruiting with the aim to fulfill certain quotas of ethnic groups, which will be stratified by age, sex, and government office region, subdivided into urban and rural, and that's for Britain. And to shape these quotas, we're using data from the 2011 census, from the annual population survey, and from the EthPop projections and estimates produced at the University of Leeds. So some of the quotas will be small numerically, and so we will have a second stage to the specification, which will boost certain quotas to give us a minimum size. And we're currently looking to define quotas around these ethnic groups listed here. So to reiterate, this is not criteria for recruitment. This is the quotas through which we will monitor the characteristics of the ethnicity of our respondents. You can see they're based largely on the detailed census categories with some subdivision and additions to those. And we also will specify quotas for religious groups and for religious groups separately from the ethnic groups. So in this non-probability inclusive approach to surveying, how are we going to recruit our 16,000 participants? Well, core to this whole project is partnerships with ethnic minority communities and organisations representing those communities. So we are in the process of building partnerships with voluntary community and social enterprise organisations across Britain. Those listed at the bottom of this slide are some of the ones we're currently in discussion with about these partnerships. So they will be contracted as part of the survey to support and deliver the recruitment and marketing for the survey. We also have a professional marketing campaign being developed by our collaborators, Words of Colour. And this will have very high quality media assets, including social media assets and campaigns, together with traditional print and broadcast media, to national media and to ethnic minority and more regional and local media. And we will have what we hope to be a very high profile launch event in the middle of January. As well as our partnership, VCSE organisations, we have collated a database of over 1,200 more local VCSE organisations who we will be contacting to distribute the information about the survey to support our recruitment efforts, and particularly this aim to recruit from across the country. But what will we ask people about in this survey once we get our 16,000 people into the survey? Well, the rationale for this has a number of criteria. Firstly, there are statistical requirements that to enable us to cross-reference to existing probability surveys. So we have to have some content that matches existing probability surveys. And there we're particularly looking at understanding society and labour force survey, which we've already heard talked about this morning. We also have statistical requirements, which I'll say a little bit about in a moment, to help characterise our participants. We need to ask them about their characteristics that are associated with our recruitment methods to the survey. So their participation in VCSEs, for example, or their use of internet. We need core socio-demographic and locational data, and we want theoretically informed content. The survey is going to be 30 minutes, so we have to fit all that into a 30-minute survey. The content that we're proposing at the moment covers socioeconomic and financial circumstances, ethnic and racial identity, a whole range of indicators there, racism and discrimination across various sectors, including responses taken to racism, health and well-being, including mental health, Black Lives Matters engagement, and we term this in a broad sense, so engagement in political activism to do with race and ethnic inequalities, caring and volunteering, social cohesion and belonging, attitudes towards the police, COVID-19 compliance, such as use of test and trace and download of apps, and trust in government at various scales. And throughout the survey modules, we're going to be focusing on both the current situation, which will be in the early months of 2021, and the change experienced through 2020. We're going to implement this survey in collaboration with a survey organisation. The tender is currently advertised, closing next week, and we hope to work with a very well-known survey company on that. The interviews will be carried out both online and over the telephone, with translations made available, with this aim of the survey being as inclusive as possible. There will be an incentive of £10 per participant to complete the survey, and we envisage it running from January and for 3 months. We will have an accompanying comparator sample, predominantly of white British population. This will be probability based, likely from an existing panel, which we envisage the survey company will be able to provide. So once we've done all this, how will we be sure that what we analyse and the conclusions we draw will be statistically robust? So we have two approaches to this, which are interlinked. Firstly, we need to monitor our recruitment to our quota specifications, and we'll run a very adaptive and responsive design. So once the data collection is underway, there will be daily monitoring of the responses according to the quotas. And this will be used to calculate an R indicator, a multivariate indicator of representativeness that we can then use to direct our recruitment towards quotas, geographical locations, ethnic groups that we are falling short on. So this is an adaptation of survey methods previously used to address non-response in probability surveys. Secondly, once we have our data, we will devise weights to account for selection bias. And this is where the probability reference samples are crucially important. So these will be used to incorporate randomization into the non-probability sample that will enable us to make statistical inferences and have population parameters with confidence intervals. And this will use two approaches, and these are approaches that one of the team members, Natalie Shlomo, has been central in developing: propensity score approaches and model-based approaches, to allow us to say how our population that we have managed to achieve through our non-probability approach approximates the probability samples that are in our references, and indeed other known populations, including the census and census 2021 and 2022. So by way of conclusion, this is a really exciting survey. It's a novel opportunity both to provide evidence to impact policy and practice, and also for methodological and substantive scholarly contributions. But there are many challenges to the project. It's quite a high-risk endeavour. It's really critical that we engage the right constituencies and that we reach our target overall sample and the quotas that we will specify. But potentially there's a really high reward, because this will provide data that currently we can't get anywhere else on the experiences and the social contexts of ethnic minority populations in Britain. It's a superb research team, crucially bringing interdisciplinary expertise, which I think is absolutely vital for this project. And it builds on CODE's very strong track record on ethnic inequalities using a mixture of research methods. But we don't have a lot of time. We only have about 4 months to complete our data collection. So in sum, this survey is a very important and timely project that both augments and complements other initiatives, including those we've heard of from ONS and the RDU, because it provides novel information for understanding the experiences, the contexts and the causes of differential experiences of the coronavirus pandemic. And although it's a great challenge, my predictions are that we're on track to a successful survey. Thanks very much.
Thank you very much indeed, Nissa. So lovely description of a different kind of data and a much more planned data collection exercise than some of what's been talked about before, where using routine data. So, and again, the chat has been absolutely burning, so you may want in a minute a chance to sort of scan through that for specific questions. So what we're going to do now is to move into panel discussion. So what I'd like to do is to ask all three speakers if they don't mind turning on their cameras and using their mics as appropriate. And I would encourage people to, I'm going to take a couple of issues that have come up in the chat first, and then I'll encourage people to put up their hand. And what I'll probably do is to sort of take 2 or 3 questions at once and come to the panel. But the two questions I'd like to pick out from the chat to start with, and I'll go around and I'll warn you in the order you spoke in to start with, is first of all, there was a lot of questions about missing data, particularly in the Public Health England CHESS data set, but also more generally. So what are the reasons for it? What difficulties does that present you with, and how are you coping with them, and going forward, how can you improve the quality of that data? So that's one issue. And then the second issue, and I think it was expressed very nicely by Elizabeth Webb, who said that, I'm just looking for the right, because she's asked more than one question, which was essentially what I might call, bear with me while I just find it. Yeah, so she was asking about adjustment. So when you're adjusting relationship, for example, to ethnicity and COVID outcomes for socioeconomic factors, what's the goal? What's the fully adjusted factor mean? And I think, and how do we avoid the implication that the covariates are actually unimportant side issues, because ethnicity can mean all sorts of things in different contexts, from possibly some genetic underpinnings, which is how people often interpret it, through all sorts of social things. And so what you adjust for and what you actually think, well, this is part of what ethnicity is codifying or acting surrogate for, is really important. So I think some discussion on approaches to that would be helpful. And then after that, we'll I'll look for some hands up. So missing data, and if there's you can do one or both of those. It's not that everyone's got to speak in everything. But I'll start with Liz.
Great, thanks very much. And two, I think, really important questions there. Missing data, it's a real challenge, I think, particularly on administrative data. And I think it's one of the things that we want to explore more through the Inclusive Data Taskforce, as well as through our general work, and understand the reasons why there is missing data, which could be multiple different causes, including, and I think I mentioned this briefly in my talk, about how we build trust among people to provide their data in different settings. And part of that is being clear and open and transparent about how their data is going to be used. So I think there's plenty more work to do there. The challenges are different across different sorts of data. There's different challenges with the administrative data to survey data, but challenges on both. And then obviously the census data helps us in important ways to fill some of those gaps. A related question that I saw come through in the chat, which I'll sort of just address here, is the challenge of having the right in. The data obviously then feeds through into analysis and the granularity of results you can produce. And I think some of the conversation in the chat was around, are these challenges with granularity, for example, on the infection survey. So yes, that is having boosts to have better data on more granular ethnic groups in the infection survey is something that we're considering at the moment. And I think it's an important thing to be looking at. And I think on the adjustment, that's a really valid point. And we have to be really careful, I think, especially when we are sharing analytical results with a more general audience. We know what we mean by accounting for different characteristics, but it can sound quite odd to a non-analytical audience and quite unclear sometimes about the messages that we're trying to get across. And so I think really being careful about how we communicate some of the findings is really important, and then to understand how people, especially how policymakers, should act on those findings, and being quite careful about how that's communicated through. I think it's a really valid and important point. So thanks.
Thank you, Vasileios.
Thank you. On the data quality issue about CAS, what we're planning to do is to do an audit on ethnicity recording or declaration levels across health sources. And we're working with Department of Health and Social Care, NHS England, Public Health England, as part of our next steps in our COVID-19 BAME work. So that's something that we have identified. We try to look, and I'm aware that Open Safely, when they're looking at the hospital episode statistics data, they do further analysis on the unknown ethnicity. Something that you mentioned earlier on about genetics, if I'm correct, the SAGE subgroup on ethnicity is looking on these particular questions, and they have mentioned that genetics they don't play such an important role for COVID-19 infection or mortality, but also looking at other aspects such as vitamin D as well. That has been quite a lot in the media. And then I will echo the comments from Liz about when we take into account quite a lot of different indicators into our models. We need to be careful on that. We probably plan to do something in plain English and publish over the next couple of months for people to be aware about how to interpret these statistics.
Okay, thanks. Nissa.
So on the missing data point, I think what Liz raises about trust in data collection is really vital. And I think there's people in the audience who probably have a lot of experience about how ethnic minority populations do and don't engage with data collection initiatives. I mean, even in our wonderful project of the census, this is a problem, and our gold standard data collections. And I think it's important here to note a distinction between ideas of migrants and ideas of ethnic minorities. And of course, there's interrelations and overlap there. But I think particularly for migrants who don't have full status or leave to remain or citizenship, the data collection can be quite a frightening process, and it can be associated with the governance of their right to be in the country. So there's a lot of sensitivities around these data collection and engagement in data collection that I know that the ONS and RDU and others are very aware of. But it helps, I think, to reflect back on the concepts of who is it we're trying to engage with and for what purposes, and what is it about their experiences that we're concerned with. Which leads me on to your question, Deborah, about the meaning of ethnicity and what is it we're trying to get at. And when we see these differences, which have been very nicely illustrated today, what do we lean towards when we're looking to understand the causes of those? And certainly in our work, we're putting to the side the genetic explanations, and we're looking much more about the social context in which people live, which in understanding coronavirus, of course, relates to things that have been mentioned, such as household context, exposure through kinship networks, friendship networks, work environment, travel to work, and so on. But also, crucially, I think we have to engage with experiences of racism, which affects lots and lots of these covariates or predictors or associates of experiences of coronavirus and indeed other outcomes along which we see ethnic disparities. I mean, work by my colleagues on this project, Laia Bakaris and James Nasru, has very strongly pointed towards the association between experiences of racism and negative health outcomes, both in physical and mental health. So I just want to bring that in, that we shouldn't ignore that alongside a lot more of these medical approaches and focus on comorbidities. There's a few comments I'd like to respond to. Should I wait, Deborah, or go for it?
Well, shall I tell you, perhaps nobody's put their hand up yet, so I'll tell you the theme I was thinking of doing, and I'll put that to you, and I'm going to start this time with Vasileios and then you, Nissa, and then Liz, if that's okay, just so that we don't have the same order every time. But I think there's a lot of discussion in there that you just begin to touch on about engagement with people from Black and Asian minority communities. Some people use engagement in the sense of how do we get people to participate in the research, but certainly in the world I come in from medical research, we talk about working with patients and the public co-production. And I don't know whether, for example, Emily Jester-Meyer wants to come in. She says they're doing work on engagement with understandingpatientdata.org. But that's and Wanda from the Equalities Trust is flagging up that many UK-born ethnic minorities have a very real distrust of authority and giving over of data. And if I'm very conscious, and this is no disrespect to anybody with their cameras on, but we have a panel that's diverse in terms of where we work, diverse in terms of geography, diverse in terms of the kind of data we're collecting. We haven't, despite best endeavours of people arranging the meeting, actually got a particularly diverse in terms of ethnicity, which is deeply ironic. And so I really think the least we could do is to sort of have some discussion on that. And if any of the auditors here they'd like to bring in, please raise your hand and I'll bring you in as well. So I'm going to go around in that, and I don't know whether that's what you were going to pick up on or whether you've got other things you were reacting to, but Vasileios, would you like to start with that?
Yeah, so on the question around the behaviors and trust from the ethnic minorities community, I think that's something that we acknowledge, and there has been quite a lot of work to try to make health-related messages to make them more related to ethnic minorities. And there has been quite a lot of funding going on that. And I think what we need is to collaborate more with the local authorities. And there has been quite a lot of work happening on that. It's quite important also as well to understand how the behaviors affect the risk of infection and mortality as well. And this is something that we don't have quite good quality evidence on. And hopefully, if the opinion and lifestyle survey provides some robust on ethnic minorities, that will be very helpful to understand more about that.
Okay, thank you. Nissa. So Nissa and then Liz, and I can see that Wanda Raporska's put a hand up, so I'll go to her after I've been to the other two speakers.
So on the trust and the engagement of ethnic minority communities and co-production, I'm absolutely in agreement about that partnerships are needed, and this survey project is a good example where it's just not going to succeed if we don't have that buy-in, so to speak. And that's why the core of our work now is building these partnerships. I'm really glad to see Emma from Friends, Families and Travels here, who we hope to be collaborating with. And Wanda, I noticed you've put loads of comments in the chat, so very glad to speak to you about the project and potential collaboration. I mean, this is absolutely vital, yeah, both in terms of the data collection, but also in how that's received afterwards and how that is promoted, and indeed in prioritising how we analyse it, what we publish, the way in which we publish, how the communications of the results are accessible to a broad range of audiences. So this isn't a project that is co-production proper, largely because of the time frame and having to get underway and complete a very large project in 6 months. But perhaps it will lay foundations for work that is much more of a thorough co-production model. Diversity of research team, yeah, and of the panel here, that is a problem that we face in academia, as many people here will know in general. In the university where I'm based in St Andrews, it's very high on the gender, very international in our students, international in our staff, but not in terms of ethnicity and race. I'm aware of this as well. I'm currently chair of the Population Geography Research Group of the Royal Geographical Society, and this is something we're very much trying to address amongst our membership and committee. But on this particular team, for the survey projects and for code, I'm very glad to say it's incredibly diverse. We've got overrepresentation of Black, Asian and other ethnic minority groups. We've got a wide mix of career stages. We've got female Black professors, female male Black professors, which, as many will know, are quite in the minority in academia. So I think I'm actually a minority among the research team. So we are, as a collective, I think, representing the ethos and the diversity that we're trying to follow.
Okay, thank you. Liz, and then Wanda.
Yeah, thanks very much. And I think the previous two speakers have made some really good points. I mean, for me, this is about partnership and realizing that we won't have all the inclusivity we need within ONS to understand the lived experiences of people from many different groups in society when we go about data collection, analysis, and I think importantly dissemination as well, and how and where we disseminate analysis at the end is really important. And I think partnership is very much part of our strategy now within ONS, and we see this not just in our work on ethnicity, but across a number of areas. Then actually working with civil society, working with other organisations and actors can really help, both in terms of how we design and collect our survey instruments, but also then how we disseminate the messages from it. And so I can think of examples on work we've done on topics like domestic violence and child abuse, where actually working really closely with civil society has helped us share findings and put them in the hands of practitioners in a way that we don't have the same access or reach on. And so for me, I know that there will be many people in this call who've got some incredibly valuable insights on this, and hopefully we'll share some of those in the chat, because I think it's an area where there's a lot to learn and a lot more to do, but there's a lot of good ideas to help us get there now, I think.
Okay, thank you, Liz. Wanda, you've been waiting patiently, so could you unmute yourself and make yourself visible if you want to? And
Hi, thank you very much, and thank you for giving me this opportunity to speak. I will admit I found an email very late in the day inviting me to be part of the panel as someone had dropped out, but unfortunately it wasn't timely enough, so we could have contributed to that lack of diversity on the panel. So apologies for that. I mean, I think really, talking about co-production, we have the same problem that we have in terms of policy making. When we have a very white middle class set of people deciding on policy, then very often we have the wrong questions being asked in the first place because we're not taking lived experience into account. And I think this is very much the point in academia, which is all very well for me to say because my academic background is in dead people in the early modern period, so slightly easier to work with. But that's why we've been working with the IFS, for example, on the Deaton Review to ensure that academics are looking at the lived experience and hearing from people with lived experience before they start to formulate their academic work or their hypotheses, because that means that there is input at that first point. There is a lot of lived experience that's being collected by civil society in these areas. And to be honest, I'm always slightly disappointed when organisations and academic research is focusing on experiences absolutely minority populations. I really think there can be a lot more imagination brought to that. And my feeling is this, just from listening to this meeting, is almost that this is almost ethnography. This is looking at people in a goldfish bowl to try and extract again stereotypical narratives about ethnic minorities. We are not homogenous. We are not just one ethnic minority. We are, there are actually middle class and upper class people who are from ethnic minorities. So to continue to have this whole conversation about ethnic minorities and violence, ethnic minorities and crime, without being more nuanced and looking at inequality in all its true forms, and this is a huge result of siloing. So, when we're looking at these issues, we're looking at economic and social inequality and the intersections. And, my plea really is to stop working in such silos, and to take all of the experience, not all of the experiences of everybody, obviously we can't do that, but to take a broader view of how we're looking at ethnic minorities, and also to not sort of be naive about thinking that this is new or these approaches are new, because they may be new for some strains of academia. But I think that has always been a long-standing problem in academia, which is getting better, the lack of interdisciplinary studies. So, working with civil society, working with other organisations, I think would bring a much richer and more nuanced approach to this work.
Thank you. That's really helpful. So that's bringing in more sorts of diversity of people working together or groups working together than perhaps we've articulated. I hope it's in the spirit of what we're trying to do. But as you probably gather, some of us are struggling to know as to how to do it and what best to do. So that is great. Right. More voices. We've heard a lot of voices from me and from the panel members, but Wanda so far is the only member who has spoken up, but we now have we have Jagdavidi and we have Anil. So start with Jagdavidi.
Hello, very interesting presentations, and good to hear about all the work that is going on. One of the issues that I have, I think, is that we have these occasional discussions on equalities and so on, but we don't have an organized user group for information on equalities and so on, and whether that's something that we should get the Systics User Forum to press ahead with for the RSS to facilitate and bring together all the potential users in this area. And the other thing is, one of the sort of issues I always have in the back of my mind is the ethnicity classification that we're using, which date back to the 70s, 80s, with tinkering with every census. And it really is about time that we sort of started the blank sheet to say, what would it look like if we started now looking at what breakdowns we should have. For example, the Indian category is so large and varied. What you have within there is so varied, with those in West Bengal could be very similar to Bangladeshis, those in the west of India closer to Pakistanis, those in the south, Tamils similar to Sri Lankans, with all these different sort of characteristics. And the particular sort of group I'm involved with, the British Sikhs, they're sort of hidden within the Indian category, but they have quite unique characteristics. So another issue, discussion going on in various circles about them being wanted to be a separate ethnic group. I don't necessarily agree with that, but I think there's a need to either sort of analyze more of the data by religion or see what more can be done. ONS this year published some data by religion on the COVID mortalities, and I think that was very useful. And it's how we can do more of that. I think that's the type of data to show what can be done by combining the ethnicity and religion data and other sources of data. Because there are some ONS surveys where religion is collected, but it's not used because of sample sizes, and maybe combining 2 or 3 years of data, we could do more. I think that's sort of quite critical. And then working with the community. So I sort of do, I'm the editor of a publication called the British Sikh Report, where we do a survey of Sikhs in Britain every year. And we look at particular topics. So this year we're looking at things like organ donation, adoption, fostering, so various sort of social issues sometimes that are not generally talked about in the community. And again, it's a group that we could engage with the sort of work that's going on here. So really it's more sort of comments rather than questions, I think, and observations.
Okay, thanks, Deb. But some really constructive, practical suggestions there that we might be able to take forward. Okay, I'm going to ask Anil to speak, and then I will turn to the panel to respond if they wish to. So, panel with your hand up, can you unmute yourself and mask yourself if you want to?
Okay, thank you for nice presentation. My only concern is that if the people are recruited, or just like the mortality data we are looking at it is coming through NHS. So we have got a fairly large representation of whether the young BAME people or the oldest BAME person, ethnic minority person. But when we are talking about the survey, generally the survey is taken in the English mode, and you can now assume that next 5 years we are going to do surveys online only. And in that case, the recruitment of older generation from ethnic minorities completely neglected, because language is the main important part of it. And as a result, they cannot participate in the online survey, and the co-production model also will work only those who are active. Those BAME people who are active, generally you will find the male, youngsters, these can participate, or highly educated people. But what about the non-included, or here's the criteria. So basically all the surveys right from the beginning, even the James Nazru also said that though we introduced a booster sample in England survey for health, and in the 2004 and also in 2008, but we have observed more of a closed household. People have migrated from out, because every time, though they live in a rented accommodation, so mobility is very, very high. The language is the main important part, because surveys is done in only in English languages. So far last 20 years, we have not devoted much time to recruit the older generation of population in the survey. And you can see also in the COVID, the average age of death is about 60 or 65. So mean age I'm talking about. And if you want to do again survey for COVID people through this, if you're going via NHS, I can say, yeah, you can be able to recruit. But if you're doing just like a random survey, or even doing the where we know already the certain postcode has a high concentration of ethnic minority, but again, we survey instruments we are using in English, we cannot reach them. So it's very important how we can recruit them. That is a very important criteria. And the other issue also, it remains the surveys, whether it's health survey for England or any type of a survey, we always, when we are talking about ethnicity, either 18 category classification or 9 classification, in the last we write prefer not to say. And that has been, I'm just analyzing the Sports England data, and we have seen that prefer not to say is a very large category, 5 to 6%, which is more than even the Black community in the whole of UK in terms of population. So if you are not giving any choice of a census, give the choices. If your ethnicity is not in the 18 category, please specify, write it down. But in the other surveys, we always give a choice of a very easy option, just tick mark, prefer not to say. So that becomes a very big issue. We know they belong to ethnic minority, and even Deborah do a multiple imputation method of missing data. It will try to classify into the white group. Basically, white form the majority population. So I don't agree with computing multiple imputation. So I'm going into technical issues. That is entirely wrong. You can do multiple imputation on quantitative data, not on categorical or discrete type of a variable. That is a very important fact of it. So I'm saying in the future, whenever you're doing co-production, doing a household survey, you have to use a better source that this should reach to the older generation of the ethnic minority population, and preferably in their own language. I know language is a big issue of translation and costing is out there, but we have to make some effort so their voices can be heard.
Thank you, Anil. Right, you've made lots of good points there. What I'm going to do, we've now got 10 minutes to go, so I'm going to take the last question that I can see from Christine Dellon, and then I'm to give them due warning. I'm going to turn to the panel, and this time, as you might guess, I'm going to go Nissa, Vas, and then Liz, to pick up any points you want to from either these three questioners or anything you've seen in discussion or what struck you. Just of some last remarks, and then I'll close the meeting. So, Christine.
Oh, hello. It's been a great panel. Lovely to listen. I'm just working on data with ethnicity, and one thing I need is to calculate rates. So the different ethnicity groups are much younger than the white ethnicity groups, and then if you want age standardized rates for comparisons, if you're looking at something that affects more elderly people, you really need the rates and the population breakdown by ethnicity. So ONS has published aged-on statistics, but these aren't official statistics. And I just wondered, I sort of think producing rates is sort of the most basic thing you can do, and this is sort of an essential feature for it. And also the aged-on statistics, they have their methodology, but this hasn't really been tested or not quality control, but there's still more work to be done with getting these data. Ideally, it'd be wonderful if we could have it as an official statistic. So I just wondered if you had any thoughts on the aged-on ONS data based on the 2011 survey, and if there's going to be more work done on that, and if we really are going to have ethnicity in mortality data so that we really can understand the base population so that we can calculate rates.
Thank you, Christine. Right, now we've got 7 minutes left, so we're not going to get answers or responses to all the points that have come up by any means, but just a minute or two, so Nissa and then Vasileios and then Liz. So Nissa, what would you like to your parting remarks to be for now? I regard this as the beginning of a debate rather than the last word.
So thanks for all those really thought-provoking comments. To Christine, I really recommend the University of Leeds FPOP projections and estimates to you. I know they've worked that team's worked closely with ONS, but for now that might be a good source. And to Anil, absolutely, the small samples of older ethnic minorities is a major issue, particularly in the surveys you mentioned, Health Survey for England, even in Understanding Society, which is probably in survey terms is our best bet for ethnic minority populations, though that does suffer largely from a lot of attrition, as you say. In the survey we're doing, we're really trying to pay attention to this. Some of my colleagues work in gerontology, and they're very attuned to capturing older ethnic minorities. So there will be translations both for the internet and phone versions of the survey. The phone version will be no cost. So we are trying to attend to some of these issues of how to reach a greater range of the population, including in terms of age. To Jagdev, yeah, great. A user group sounds brilliant. Count me in for that. And I'm familiar with the debates about the Sikh ethnic group category, which is really fascinating. And it's part of the reason why in our survey we are collecting all kinds of measures of ethnic identity. So we will be asking people initially to self-define their own ethnicity, a write-in option. So that would be up to who participates to define that, and that will be supported by the census questions, by religion and ethnicity, and also questions on birthplace, on nationality, passports held, and so on. So we'll hopefully have multiple ways at getting at people's ethnic heritage, if you like. And finally, to Wanda, wonderful. I'm really glad to hear that of the work going on. I'd love to hear more about your project with the IFS. And I absolutely agree about the problems of siloing and stereotyping and the need to take an intersectional approach in understanding these inequalities. Yeah, we can critique the perspective taken by a lot of academic research. Our own research is based on the work of code that's been going on since 2012, evidencing patterns and processes of inequalities with an interdisciplinary team applying mixed methods and working in collaboration with local and national civil society organisations. So we do hope that we are representing views of the people whose lives we hope to impact, and indeed that our research questions are informed by the live issues of those populations. So in conclusion, final remarks, again, very grateful to the RSS and ONS for organising this event. Although these debates about measuring ethnicity have been alive for decades, since ethnicity was still considered initially considered as a census question, I think they're perhaps more lively than ever now, and I think that's a good thing.
Thank you very much, Nissa. Vasileios, what are your final thoughts?
Thank you very much. There have been some very interesting comments, so thank you very much for that. A couple of notes for me in terms of the ethnicity classification. I think we believe into a harmonized approach, and as we were waiting for the ONS, Government Statistical Society, to help us with this approach. In terms of intersectionality, there's quite a lot of work that needs to be done in terms of religion, but also including on sex, on disability as well, and especially this is quite related for the COVID-19 question. In terms of the languages, I totally agree. Messages they need, surveys messages they need to be in different languages, and this is what we will be trying to do, try to translate health messages to many different languages. Last but not least, I would like to mention that Race Disparity Unit is a diverse team. We would like to speak with as many people as possible. The fact that we have managed to provide answers in some of these disparities is that because we collaborate with academia, we collaborate with other government departments. We live in the middle of a global pandemic, and we need to work together to find better data, better evidence for the policy at the moment. Thank you.
Thank you very much. And then Liz, last but not least of the speakers.
Yes, thank you very much. And I think I would echo the point just made entirely, that it's by working together across those different boundaries that we're most likely to make progress here. And I think some of the comments we've just heard points to the ways in which challenges still remain in terms of making sure that we're reaching all different groups, understanding the challenges of why people are not partaking in surveys or not giving their information, administrative data. Then thinking about, are we using the right methods, the right approaches, the right analysis to really shed insight and do so in a way that's timely to the policy challenges being faced. And then thinking again how we disseminate that information and make the biggest possible impact for it, so that it's actually getting into the hands of people who can use it to make better decisions, both for themselves and for others. So I think, I'm an optimist, and so I think that we now have behind us some real momentum to make progress in this area. But we'll make progress best when we collaborate and draw on the expertise and indeed the lived experiences of people to address some really difficult challenges, I think, at the moment. I think people have made some important and detailed comments, which would be happy to address offline and take some of those forward. But really, just thank you for everyone for coming today and contributing to a really interesting session.
Thank you very much, Liz. So to finish, this meeting, as you may know, was oversubscribed. So well done to the audience for getting in quickly. That does mean we want to put it online. So as I said at the beginning, if there was anything that any of either speakers or anybody else said that they're not comfortable going to public domain, please do let us know so that it can be edited out. And there's a couple of weeks of editing, but do let us know as quickly as possible so that we can do it as we're doing the main thing. It just remains for me to say thank you primarily actually to the people you haven't heard from, Mags and Lutz, for arranging this meeting, getting it set up, giving us our technical rehearsal earlier. Really important to get that together. I want to thank the speakers. I want to thank both everyone who's been putting stuff in the chat and for those who spoke up and participated and made this a wider discussion. This is a difficult area. We're doing some things well, some things okay, some things very clumsily, but I feel strongly that it's only by addressing it and having these discussions that we'll start to learn to do it better and to work with all the people that we need to. So thank you so much for taking part in it. And I think with only a minute over time, I'm going to declare this meeting closed and wish you a good lunch break. And if your weather's anything like mine outside, please go and get some daylight while we can have it. So thank you very much indeed.